drive has started, and of course, the COVID pandemic has gripped our country. Yes, Dr. Vivek Gupta, what is your tribute to frontline workers? What would you like to say today on this occasion?
I'm so thankful because I personally working and I have faced patients. I have worked hard to see the patient going on. I have seen the patients dying. I have seen the healthcare workers getting infected. I have seen the people who have been the family who have been really devastated. So I have passed through the first as well as second wave. I have treated thousands of patients through the Apollo, otherwise also on the app. And I have being the witness and doing the webinars to teach and educate the people. So at this point of time, the healthcare workers have actually done their best. And I don't see, I worked in France, worked in Europe, I've seen many countries in America. The emotional part of the healthcare workers, which I've seen in India, is not existing in other part of the world. So I personally speaking, and so our country is having emotions. We are full of religion. We are God-fearing. And therefore, all these people who have worked hard, I really give a full thank and hearty thanks with my whole core of my heart that they have done extremely tremendous job, especially in allaying the fears and telling the family that everything will be all right. So now since Omicron has evolved, it is almost 2 years. We know that this Omicron is not dangerous. It has not caused so many deaths, but I still give a small caution through your channel that still don't take it lightly. So we have to wear the mask, we have to get our vaccination done, the booster dose possible, and of course the government should slightly ramp up more the vaccination and also the testing. You see the testing process, which I always tell, that what America is testing, they have 15 lakhs cases almost per day. They are testing almost 10 times more what we are testing. But doesn't matter because we have a special drive to test. We are testing about 12 to 15 lakhs population per day, which is not so much, but still it is there. So we have to be careful. And I not only give the tribute and thanks to the people, but I also give the tribute to the people who have really been affected and they have come and recovered. So we are all working hard. And I think this COVID pandemic will go off. We have seen the earlier pandemics like what Spanish flu that not more than 2.5 years or 2 years. We already crossed 2 years. We hope that by the end of the 2022, we should be finishing off and it will become endemic like what other common flu says. So the only last word which I would like to tell you there through your channel is that we have to be still careful. The whole country needs to be vaccinated and 6 monthly plan of vaccination very more important rather than 9 monthly. As a doctor, I feel I have seen my own antibodies weaning off at the end of 7 months. They were almost very less. And that's why we have taken the booster dose. Most of the people, the antibodies goes away after 6 months. And therefore, we have to have a 6 monthly vaccination for COVID as an essential part. And it should be a mandate. Now we have to do a mandate because there is some vaccination hesitancy. And we have to put it as a mandate. And then only the whole country we will be able to vaccinate. Once we are able to vaccinate completely with second dose, the whole country, we will have the third, of course, the booster dose coming out every 6 months. This is for sure. We can't live without vaccination like influenza, we are doing it, but influenza, we're not doing a mandate. It is the choice of the patient and the choice of doctor who prescribes it. But for this COVID, because the COVID is special because it causes more deaths, it causes more pneumonia, it causes more thrombogenicity, it causes more heart attacks. Because of thrombogenic potential, we have to check the D-dimer, we have to check the C-reactive protein, we have to check the LDH level, and we have to check the IL-6 level. So we are twice bitten, thrice shy. And therefore, I personally feel the government of India should bring such legislation, or not only legislation, but also the directions that every population will need to be vaccinated every 6 months with this COVID vaccine. There are some doubts coming up that these vaccinations, especially the immune escape, which is happening with Omicron, can happen with the other vaccination, because especially the Pfizer and Moderna. I have really been talking to many people who are in United Kingdom, those who received the Pfizer shots and Moderna shot. They have been more, in fact, they have got this less protection. So I personally feel that Covishield and Covaxin are doing a good job, and the immune escape is not that much in these two vaccines as compared to Pfizer and Moderna. Despite having the 90% efficacy, which was there with the Moderna and Pfizer, while only 70 to 75% efficacy with the Covaxin and Covishield. whatever said and done, all the vaccines are important and the vaccination drive has to come. Only thing which is still lacking is the increased number of vaccination per day. It has to come up at least 50 to 60 lakhs per day. And that will only help the whole country, which is about 137 crore population. And I really request once again the Ministry of Health to bring the vaccination for 12 to 15 children who are getting infected, and also to the younger age of population, and booster dose for 45 to 60, and then we can go for less population as well.
Okay, let's leave it at that. My thanks to all of our guests for joining us. We truly salute the frontline workers from our entire team at NewsX. A big thank you to our frontline workers for, of course, being part of this movement, being part of this entire one-year fight against COVID and effort to get our country vaccinated.